Hi, welcome to Suman TV viewers. I am Dr. Chava Anjaneyulu, Chairman and Senior Consultant ENT Surgeon working with the Asian ENT Care Center located in Panjagutta, Hyderabad. Migraine patients have problem of the headache. Most of the times it is unilateral and it will increase with stress. That may be with irritation or too much speaking, too much noise exposure, too much journey, lack of sleep, not taking food according to time, and in ladies sometimes in periods of time also. Migraine mainly disease of exclusion and symptoms will be there in other problems like brain tumors, brain blood flow pathologies, any infectious problem. Most of the times patients will have headache, sometimes with nausea and vomiting. How to diagnose migraine? Migraine mainly diagnoses the symptoms and we exclude other problems with the radiological investigations like MRI, mainly brain tumors, aneurysms, or strokes. All these we can exclude with the MRI. Then we can come to the conclusion patient will have the migraine. Usually migraine patients will have complaints of little bit dizziness or imbalance, photophobia, headache, nausea, vomiting. Mainly unilateral headache, one side. Most of the times migraine symptoms improve with the rest. If you have headache, if you sleep or take rest for half an hour, 1 hour, your symptoms will become less. In all headache patients, we do either CT scan or MRI. That is compulsory, especially to rule out benign intracranial hypertension. Benign intracranial hypertension also, patients most of the times will have headache, nausea, and vomiting, and sometimes visual disturbances. In examination we find the pressure changes in the eyeball also. Sometimes migraine will have association with intracranial hypertension, sometimes ear pathologies like Meniere's disease or other vestibular problems, other cochlear problems, sometimes with cervical spondylosis, sometimes with carotid vessel problems like thrombosis of the carotid vessels. So always we have to check from all points patients is have any other deficiencies, especially vitamin D and vitamin B12 also. So with all these investigations we exclude nutritional problem, blood vessel problem, any Meniere's disease, inner ear problem, and brain problems. Once you diagnose Meniere's disease, mostly this migraine, once you diagnose migraine is mostly a lifestyle disease. If you take proper lifestyle, if you follow the proper lifestyle, most of the times migraine symptoms will become less. Mainly do some yoga and body relaxation exercises and proper sleep, avoid excessive journeys, avoid excessive cold and hot exposure. Don't go in too much hot weather or too much cold weather. Don't irritate and don't shout. Don't become restless. Don't use phone or headset as much as possible. Take balanced diet according to your need. If you are obese, reduce your weight. It is very important in obese patients. Migraine attacks are more. And during periods also, if you reduce your physical activities, your migraine attacks also become less. And some children will have problem with more studies, especially in late night study. So they have to reduce the late night study and they can study in the daytime or early evening or early morning hours. So taking all these precautions, mainly physical and mental stress, you reduce it, most of the times your headache attacks will become less. If you are problematic, take the medicines mostly 3 to 6 months, either beta blockers or flunergen or sibelium. Acute attacks will subside. follow the proper lifestyle. Especially nowadays, pediatric migraine is becoming more. That means children, they are having headache attacks. This is mainly due to vitamin D deficiency and obesity, taking junk food. All these increase the migraine. So children also, you reduce junk food, reduce fat diet, reduce the weight, ask them to do reasonable physical activity. Most of the times with all these precautions, your attacks, migraine attacks will become less. If you have any problem of headache, migraine, contact Asian ENT Care Center. They will diagnose your problem, they will treat according to your symptoms, and they will advise all preventive measures. For further follow-up, subscribe Suman TV.